Good morning, everyone. I'm presenting this work on behalf of Gajiro Lake, my PhD student who could not be here today. All right, these are my disclosures. Rational opioid prescribing is currently a major challenge for surgeons, given the opioid crisis that started here in North America but now affects other parts of the world. Patients undergoing colorectal surgery, unfortunately, may be at increased risk of opioid-related harms. Compared to other general surgery procedures, patients undergoing colorectal surgery may be at the highest risk of becoming persistent opioid users, with around 10% of patients continuing to take opioids beyond 3 months postoperatively. And also, as with any surgical population, many opioid pills prescribed at discharge after colorectal surgery may go unused and become an important source of opioid diversion for non-medical use in the community. However, despite these challenges, patterns of opioid prescribing and consumption after colorectal surgery remains largely understudied. Therefore, to bridge this knowledge gap, the primary aim of our study was to assess the extent to which opioids prescribed at discharge after colorectal surgery are actually consumed by patients. And secondarily, we aim to identify patient and care characteristics that may predict post-discharge opioid consumption. So this was a multi-center prospective cohort study conducted at 2 university-affiliated hospitals in Montreal, Canada. At both institutions, perioperative care was according to current enhanced recovery guidelines. And in one of the institutions, patients undergoing colectomies or ileostomy reversals were potential candidates for same-day discharge. We specifically targeted adult patients scheduled to undergo elective colon resection, rectal resection, or stomach closure with a few exclusion criteria shown there on the screen. And we use a very comprehensive measurement strategy, including self-reported measure of preoperative health, pain catastrophizing, and also patient engagement. From medical records, we collected information regarding surgery, perioperative care characteristics, as well as 30-day postoperative outcomes. And finally, after hospital discharge, patient completed weekly questionnaires focused on post-discharge opioid consumption. So our primary outcomes were the number of opioid pills prescribed at hospital discharge, as well as the consumption of these pills within 30 days. And to facilitate the interpretation of our results, we converted opioids into morphine milligram equivalents, and then further standardized them into equivalent number of oxycodone 5 milligram pills. And to address our secondary aims, potential predictors of opioid consumption were identified from previous literature and also clinical reasoning and entered into a regression analysis. In accordance to an a priori sample size calculation, a sample of 322 participants were required for our primary analysis, but this sample was slightly inflated to account for attrition. And to compare opioid prescription versus consumption, we used a Wilcoxon test, and to identify predictors of opioid consumption, we used a zero-inflated stepwise negative binomial regression with multiple imputation of missing data. So now finally reaching our study results. During the study period, a total of 344 participants were recruited. The mean age of these participants was 58 years old. 47% were female. The great majority were opioid naive, 74%. Roughly 70% of patients underwent colonic surgery and 30% a rectal surgery. And 65% of our sample underwent surgery using a laparoscopic approach. Our median length of stay was 30 days, with 18% of the patients being discharged on the same day. And our rate of 30-day complications was 29%, which is consistent with current literature in colorectal surgery. In terms of our analgesia characteristics, 67% of our patients received a TAP block intraoperatively, and at hospital discharge, which is the main interest of our research, 93% of patients received a prescription for acetaminophen. Only 38% of patients received a prescription for NSAIDs. And finally, 92% of the patients were prescribed opioids at discharge, most commonly oxycodone and hydromorphone. Now reaching our main study outcomes. At hospital discharge, a median of 13 opioid pills were prescribed to patients in our cohort. And surprisingly, within 30 days, patients reported a consumption of a median of 0 pills. You heard it correctly, 0 pills with an interquartile range from 0 to 7. And overall, 51% of the patients reported not consuming any opioids post-discharge, and roughly 63% of all the opioid pills that were prescribed to these patients were left unused. In our regression analysis, lower age and rectal procedures were independently associated with opioid consumption. But most importantly, the number of pills included in the patient prescription was the strongest predictor of increased consumption post-discharge. Our study is not free from limitations. Opioid consumption was patient-reported. Therefore, our study is subject to recall bias or even to inaccurate responses due to stigma regarding opioid use. The study was conducted in Canada. Therefore, our findings may not be fully generalizable to other countries, including the United States. And very importantly, many patients did not receive a peripheral nerve block or a prescription for NSAIDs, which is currently recommended by enhanced recovery guidelines. So we cannot exclude that further optimization of multimodal analgesia could have further reduced opioid consumption and increased rates of opioid-free analgesia. So in summary, these cohort studies support that most of the pills prescribed at discharge after colorectal surgery are not consumed by patients. Prescription size was the strongest predictor of opioid consumption, and this result corroborate the results of studies in other surgical populations. But most importantly, we think that the main take-home message from this study is that our findings support that post-discharge analgesia strategies with minimal or no opioids may be feasible after colorectal surgery and should be further investigated in future research. Thanks for your attention.